Okay, so we're going to work on rolling the thoracic spine, so the upper back and the mid back, to try and help with back pain. Now, what you'll usually see is people using one of these, which is a foam roller, okay, which is a decent bit of kit. But I'm going to give you a slight alternative. So if you haven't got one of these, and so what I'm going to do is give you an alternative to this, which might be in the long run actually better for you. So the thing with a foam roller is it's actually quite thick. So if you look at the radius or diameter of this, it's actually quite large. And what tends to happen is that when people roll on this thing, okay, they tend to either put a lot of pressure on their neck, or they completely fold over the thing, okay, and they're moving from one segment and not their whole thoracic spine. So each segment, or each little bone in the thoracic spine, has a joint. So each little bone is a joint, basically, okay, and what happens is those little joints move a little bit each time, or each one, and that adds up to a lot of motion, or a lot of movement. So when you lean back, okay, that is the combination of 12 thoracic vertebrae all extending or all moving a few degrees each segment to add up to a big movement, okay, or what we call gross movement. And like I say, what usually happens with the foam roller is that one of those segments is usually more mobile or moves more than the rest of them. So you have a stiff region where a number of vertebrae are stiff, and that can be caused by sitting at the computer, driving, all sorts of things. Okay, but to target those stiff ones, we're going to use a towel, not a foam roller. Okay, so let's get that out of the way. So fold up a towel nice and long, like a sausage. So if you look at the diameter of this one, it's a lot smaller, the radius is a lot smaller than this one. Okay, so we're going to be able to target the upper back and those segments that don't move a little bit easier. Now, if you've got, I've got some nice pads that we use in the clinic, but you can have a pillow or a blanket, whatever you want to support your head. So what you want to do is line the towel up with your upper back, okay, wherever you feel a bit stiff, and then you're going to get those pillows or blocks, and then all you're going to do is gently kind of lift the sternum towards the ceiling, okay, and then back down. So you're going to completely relax on the towel, and then draw that sternum up gently towards the ceiling, and then back down. We can add in some breathing. So breathing always makes everything better. So breathe in as you raise the sternum up slightly. The sternum is this part of your chest, by the way. Okay, so just imagine you're lifting your chest or sternum just towards the ceiling. Again, breath in and out. And you get a tiny little bit of motion where the towel is. Now, all you do then is you just move down about an inch or so, and exactly the same thing. So breathe in, raise that chest. Breathe out. Let that chest rest down. Breathe in. Now I've got my knees bent. I think that's easier because it takes the weight off the lower back and it keeps the lower back in a more neutral position. So, like I say, all you're doing is we're keeping that lumbar spine relaxed and we're working that upper back and middle back. So your lumbar spine is your lower back, okay? We're trying to get this upper back moving from all that driving and from the desk jockeying that we've been doing. So again, breathe in, raise the chest and breathe out. and let that kind of relax down. And you get a tiny little bit of motion where you want it to happen, not at the segment that's already moving more than it should. Now, variations that you can add in, you can cross your arms, give yourself a big hug, and what that's going to do is move your shoulder blades out of the way so you get a little bit better kind of contact with the vertebra. And again, you'll see my kind of elbows raise and come towards my head, and then when I breathe out, they relax down. Now, you might have to fiddle around with the height of the pillows as well. Again, I'll try one. So the further you go up past your shoulders, the more you're going to kind of want a smaller pillow. Okay, and again, bring those arms across you. Breathe in. Breathe out. You're getting a nice bit of motion at the segments you want. So another variation that we can try, again, we can cross the arms, okay, and then you can just roll side to side, and this is going to get a little bit of ribs involved. So moving those ribs or mobilizing those ribs. And again, you just move yourself an inch up and roll side to side. So again, it's very specific, this one. It's not a very general one. It gets a lot of good motion at those individual segments and not kind of gross movement at one segment. So give it a go, see what you think. Hope it helps. Take care.